Right? We have our first two speakers, so we're going to go ahead and get started. Um, it is now exactly 11 a.m. and we want to be good stewards of your time. If you could just give me a thumbs up or something, if you can do a reaction that allows me to know that you can see the screen and that you can see the presentation, that's always helpful. If you have that ability, not everybody has that ability. Well, thank you. All right, I appreciate you. All right, so we're going to go ahead and get started this morning. Welcome. We thank you so much for being here. The very first thing that we want to do is just make sure we have an accessibility check-in and a reminder for all of our attendees. If you're a presenter, please say your name each time that you speak. It's always helpful. Please project into your microphone when speaking, and just know that there is language access options. We have a captioner that is here today, and I will drop language in the chat at some point for that information if you need to access it. Please make sure if you have any acronyms or jargon, idioms, anything like that, that you take the time to define them. For all the audience, we are not always all on the same wavelength, although we're trying to get to the same destination. And make sure you speak clearly. Just for speakers, they were sent this ahead of time, but making sure they summarize their points and all the things that they need to do in order to make sure, as I said before, defining key terms, offer outlines, and scaffolding for the text that you're offering. But they've done all of that work, so we thank them in advance for all of that. And then for us, my name is Natalie Pennywell. I'm with DMAS. I'm with Outreach and Community Engagement, and today, I really appreciate all of you being here today. I'm an African-American woman, I have curly hair, and I'm wearing glasses today and a black shirt for anyone that is visually impaired. So today we'll have welcome and introductions. I'm going to pass it over to our speakers in a moment. And we have 3 presentations today. And hopefully I will grab our third speaker at some point. The first one is the overview of the Medicaid Works Program. The next presentation is going to be on Cardinal Care Correspondence Center. The last one is our Community Stakeholder Spotlight, which is the Virginia Rural Health Association, how you can stay connected, any questions that you may have, and any announcements that we have, and then we'll close for today. So I did my welcome already, my name, organization, and spring is here. The flowers are in bloom. Our medication is flowing for all of the pollen that's in the air. And the question today, if you could drop it in the chat, in addition to your name and organization, is if you were a plant or a flower, what would you be and why? And I would probably be a succulent, any kind, because I am resilient, but I don't always like to be messed with. So just give me my water, leave me alone. So some of the time I feel that way. So I would say any succulent, and I really love succulents. I think they're quite beautiful. So I will pass it over to our speakers for today. We'll start with we'll start with Sarah. Then we'll go to Danielle. And if you could introduce yourselves, and if you're here in the audience, if you could do the same in the chat, we would greatly appreciate it. All right, start with you, Sarah.
Yeah, good morning, everyone, and thank you for coming. Natalie, just want to check, make sure my volume is okay on your side. Perfect. Thank you so much. So my name is Sarah Cariano. I'm the Director of Eligibility Policy and Outreach here at DMAS. I am a white woman with short blonde hair, wearing glasses and a green cardigan and white shirt. And if I could be any flower or plant, I don't really know. I'm going to go with maybe a pothos, some kind of similar, Natalie, low maintenance, kind of just needs water to grow, and goes year round. I don't want to be something that dies in the winter, so needs sun year round, hopefully flourishing year round. Natalie, I'm going to throw it over to you, Danielle.
Hi, everybody. My name is Danielle Knoll. I am the operations lead for the administration and coverage area with DMAS. I'm here today to talk to you about the Cardinal Care Correspondence Center. I am a white woman wearing a flowered blouse with a pink cardigan, and I have blondish, grayish hair. And I'm sitting here trying to think what plant I would be. And I think that I will go with a holly bush. It stays alive all year. It's a little bit prickly, so, we have my little bubble area and low maintenance. So that's what I'm going with today. I'm excited to be here. Nice to see everybody.
I love that we're all like non-green thumb people. I tell people like I need a plant that's going to survive. As you can see, my allergies. It's a plant that's going to survive on its own. If it needs a lot of love and attention, I may not be the person for it. And so, but I appreciate that. And we did get a couple of responses in the chat, and Mark said he would be a pine tree, which I absolutely love. You need those. And Ashley said she would be a peace lily. I love that. And Eleanor said that she would be a fern. Oh, I love a fern. They do a great job filling space while at the same time being so functional. And a sunflower. My sister loves sunflowers. So I love that we appreciate all of the flowers in bloom in this season. A Japanese maple. That's really pretty. All right, so you continue, please introduce yourself in the chat, and just so everybody can see what you would be if you were in full bloom. So we're going to go ahead and get started. And so first up is our Medicaid Works. And Sarah, you just let me know when you want to proceed to the next slide.
Yeah, you can go to the next slide, Natalie, while I introduce Medicaid Works. So Medicaid Works is one of our kind of smaller programs within the Medicaid program. And I'm excited to talk about, we've done a lot of work in recent years, just really trying to help the community be aware of the program and know who it can serve. It, like I said, it is unique in a lot of ways. And so I'm hoping just to kind of introduce it and get the word out that it is available. To individuals in the community with disabilities, but who are hardworking and able to earn more money, but maybe still need some of the supports that Medicaid can provide. So it was established on the federal level in 1999 through some legislation that was really focused on both Medicare and Medicaid and ways in which these programs can support our working individuals with disabilities across the country. It's an optional program, so not all states have what federally is called a Ticket to Work program, but a similar program. But Virginia did adopt it as an optional group in 2007. It covers all the kind of standard Medicaid benefits, but it is what we refer to as an alternative benefit package because it also covers personal care services for individuals. Usually those types of services are only covered through our waiver programs, and folks have to meet a much higher kind of level of need to access those personal care services. But for folks in Medicaid Works, it's part of the benefit package, and then they would just need to go through kind of like the authorization process with the MCO to get them covered. But they don't need to do an additional screening like folks who would be being enrolled in the CCC Plus or DD waivers would. In 2021, we increased the Medicaid Works income limit, so that eligibility limit from 80% of the federal poverty line to 138, which is equal to the Medicaid expansion limit. And just for folks who remember, we did adopt Medicaid expansion in 2019. So we kind of did that, and then shortly thereafter brought the Medicaid Works income limit up to meet that. And despite those changes and really the benefits that this program has to offer this specific population, enrollment remains pretty low. We're around 94 enrollees right now, and so having nearly 2 million Medicaid members across the board, having only 94 in this program, obviously it's a very small percentage of the individuals that we serve. Natalie, you can go to the next slide. So to be eligible for this program, like most of the Medicaid eligibility cover groups, right? We have our non-financial things that you have to meet, and then our financial eligibility requirements that you have to meet. For Medicaid Works, the non-financial requirements are you have to meet the definition of having a disability. That does not mean that you have to be receiving Social Security disability or supplemental security income from SSA based on a disability, right? Because individuals who earn a certain amount of income, even if they meet those kind of functional requirements to be determined to have a disability don't necessarily qualify for those programs based on their income. And so because this program is kind of designed to facilitate individuals being able to earn higher income, they don't necessarily have to be receiving SSI or SSDI, but they do have to meet that same definition of having a disability. And if SSA is not determined, that individuals would have to get a disability screening through the state office at Disability Determination Services, and the local Department of Social Services helps kind of coordinate that. You have to have earned income. So it's a program that is designed for working individuals. So you have to have kind of be earning income or have an offer of job where you will be earning income at the point of enrollment. It's for individuals from 16 to 65 years old. And you have to establish what's called a work incentive account, which I will explain that a little bit more why that is required, but it is basically to facilitate the ability for us to disregard extra earned income so that someone can earn more and remain in the program. And then there's a Medicaid works agreement. So we just need the individuals enrolled to look at kind of the roles and requirements of the program and say, yes, I understand what I'm getting myself into, what I'm agreeing to here, and sign that. Individuals who are already in a waiver program, so who are receiving long-term care in the community through the CCC Plus waiver, or are in a developmental disability waiver through the DDD waiver program, cannot also be in Medicaid Works. So while Medicaid Works is not a waiver program in and of itself, it doesn't really coordinate with our other waiver programs. And so folks would have to kind of choose if they maybe met the criteria for both, which one they would want to be enrolled in and pursue. Go to the next slide. And then our financial eligibility requirements for Medicaid Works. So this is another place where this program really stands out from the rest of our eligibility groups, because there are two different financial kind of eligibility requirements that are applied. One at the initial application, and then once someone is enrolled, there are different levels that we are looking for to confirm their ongoing eligibility. And like all individuals in Medicaid, we review their eligibility annually as required by law, and then we review eligibility if someone reports a change that would maybe impact their eligibility. All other groups, we use the same eligibility levels at application as well as at that renewal, and to confirm ongoing eligibility. And so this is, again, it's kind of an little extra complicated program for us. Now that we can go to the next, and I'll explain what those levels are. So for the initial eligibility limits, when someone just first applies to this program, as I said earlier, it's 138% of the federal poverty line. Medicaid is always, for the vast majority of individuals, looking at that monthly income. So for an individual, around $1,800 a month. The resource limit is $2,000 for an individual and $3,000 for a couple. This is the total of countable earned and unearned income, right? So unearned income would be a pension, a Social Security, some form of income that you are getting that is not being produced through work, and then earned income, wages, tips, that kind of that income that's coming as direct payment for some kind of job or service that the individual is performing. If someone we're looking at the household size, so the income from the parents or the spouses are not counted, and then resources, if the individual is aged under 21, are counted at this point. So there may be some resources deemed from other household members that would be looked at to be included in that $2,000 to $3,000 resource limit. But when we go to the next slide, you'll see that we have a shift, right? So we break apart our earned income and unearned income. That unearned income, any income that they're getting that's not being produced based upon the work, that level they still have to keep under 138% of the federal poverty line. But the earned income then is kind of separated out, and individuals are allowed to earn up to $75,000 a year. That's $6,250 a month, so long as that earned income is put into the WIN account, right? So that's how we're able to look at it and make sure that this is the earned income and we're counting it correctly and we're counting it separately. So that needs to be kind of put in that WIN account. Other income that we can disregard, which we don't disregard, so we don't kind of count, is for when the annual cost of living adjustment is made for Social Security. From the day that that person is enrolled, those extra increases, if they're put in the WIN account, also can be disregarded. And so, you know, if they're being that unearned income, if they're receiving Social Security income in some way, and it's close to 138% of the federal poverty line, and say there's a big increase that year, and that puts them over that, they still wouldn't, we would disregard that. And so it helps them kind of maintain that unearned income level of under 138% of the federal poverty line. And then the resources we also look at a little differently, which we'll talk about on the next slide. So they are also allowed to disregard resources. And so resources that are not maintained in the WIN account, that are not accrued from that earned income that we're putting in that WIN account, do have to stay below $2,000. So if someone, you know, all of a sudden inherits a big amount and that's their resource, that would put them over the limit, because that resource came not from the earned income. But they are allowed to save up to almost $60,000 in that WIN account as a resource. And we don't hold that against them for that $2,000 resource limit. What's really also unique is that if this individual then transitions into another Medicaid category, so say they turn, you know, they have a change in their condition and they're like, I have to stop working. Well, if there's no longer earned income, they're not eligible for Medicaid Works anymore. So we would review them in our other eligibility categories for age-blind and disabled individuals, which do all have that kind of $2,000 or $3,000 resource limit. But those resources in the WIN account still won't count towards that resource limit for them. And so it's kind of permanently disregarded even when they go into another eligibility group. And so that can be really helpful as well to help them maintain coverage if kind of their circumstances change and Medicaid Works is no longer the right category for them. It's no longer working for them in their situation. And just as a little point of reference, when someone is receiving kind of any income of any kind, the month that they receive it, we're always looking at that as income. And then if they save it, if it's maintained the following month, that's when it becomes a resource. And so that just can kind of be a little helpful thing to keep in mind as well when we're looking at what is a resource in terms of when someone has income but holds on to it. Natalie, you can go to the next slide. So due to the low enrollment and really what is seen as potential positive impacts of this program, the last year, the 2024 General Assembly, so the one that met in January a year ago, directed DMAS to get a work group together of individuals working with Medicaid Works participants or individuals who are with disabilities who are working and other interested stakeholders to really look at the program and see if there were ways that we could make it more accessible to the community. A few of the barriers identified in that report are the low financial kind of requirements at application, right? That earned income right together, it has to be everything has to be below 138, the really low resource limit versus the much higher, you know, ability to earn and save once someone is enrolled in the program. The lack of residential supports, which are only available through the DD waiver program. You know, we do provide personal care and Medicaid Works, but not additional supports in residential services. The hesitance of DD waiver participants who may be eligible to flip between the programs. It can be, you know, concerning if they're worried about losing some of the additional supports available through the DD waiver program. Just general low awareness among the community members, providers, even LDSS staff, and the complexity of the application process. It is a bit more of a complicated process. We have to, you know, confirm that WIN account. We have to get the Medicaid Works agreement, and our Medicaid application doesn't actually ask someone if they're interested in being reviewed for this program. So out of that report, which is available online, I can make sure Natalie has the link if anyone is interested in reading it. And Natalie, you can go to the next section. There were some recommendations for how to related to each of those barriers. And I wanted to focus on the recommendations to simplify the application process because there was legislation this year to help address that. So this 2025 General Assembly session, it was recommended that we just make it easier for folks to indicate that they're interested in the program, to ask them if they, if you have a WIN account, to be able to provide that information up front, and make it easier for folks to get, understand that they have to sign this Medicaid Works agreement and get it to them in a more timely manner, and be able to get it back in a more timely manner. And so Delegate Cohen carried House Bill 1804, which directed DMAS to really just simplify the application, look at ways that we could try to collect some of this information up front to make the process and have less back and forth with an eligibility worker. It was unanimously approved by both houses of the General Assembly. It was a great bipartisan effort to just say, like, yeah, we want more people to know about and be enrolled in this program. And it was approved by Governor Youngkin. And so, like most legislation, will be effective July 1, 2025. And so DMAS is already in the process of kind of looking at our application and integrating some of these changes into our application process. And so we're just really, like I said at the beginning, very happy to come today and be able to talk about the program and promote it a bit. And please let me know if you have questions now or, through kind of our other communication mechanisms and the community stakeholder mechanisms. Please feel free to submit questions or requests for information if you think of them after today's meeting. And I think that's my last slide. Yeah, well, great. I just really appreciate y'all coming today and listening. Thank you so much.
Thank you so much, Sarah. And I do see a question in the chat. And the question for you is, I'm curious how a provider would be able to identify if and when an individual is in Medicaid Works. How would you identify that in MES, in the MES portal? And can I get and yes, she can definitely drop her contact information or the contact information for which she wants you to connect with. But can you answer that question?
Yeah, so they would be in a aid category 59. So it would be through the aid category that the individual is enrolled in would indicate if they're in Medicaid Works. And they are eligible for MCO enrollment. So most of them will be enrolled in MCOs, like the vast majority of our population, our Medicaid population.
Okay. Any other questions for Sarah? She'll be, I think, sticking around through the end of the meeting, but we're going to move on to our next presenter. All right. Thanks, Sarah.
Thank y'all.
Next, we have Danielle. And
here we go.
Danielle, are you ready to roll?
Yes, ma'am. Hi, everybody. I am Danielle Knoll, for those that weren't on the call at the beginning of the call. And I am here today as the operations lead for administration and coverage to discuss the Cardinal Care Correspondence Center. I've got a lot of information to cover today in a very short window of time, so we're going to move right on through this. Natalie, if you want to go on to the next slide, to give a little bit of background on the whys behind the centralized mailroom. In April of 2024, CMS did pass a final rule, which gives some requirements around how we identify address changes and address them, as well as how to handle returned mail. So some of the requirements included in this final rule are to utilize reliable data sources. So CMS defines their reliable data sources as use of the yellow return mail stickers that are put on the envelopes when mail items are undeliverable and returned to the agency. It also includes the use of the National Change of Address Database, or NCOA. Also, the use of coordinating with the managed care organizations to get new address updates from them as long as they were confirmed by the beneficiary. and other data sources that the agency may identify that have to go through an approval process to be added into the list of CMS defined reliable data sources. And so the goal here is to have a data source to regularly obtain updated address information for our beneficiaries. This should be done not only with returned mail, but just on a periodic basis, a check for our beneficiaries. If we receive returned mail and we go through and we check all of our reliable data sources and we're unable to find a new address, the final rule does require us to then make outbound attempts to the beneficiaries to obtain a new address. And those attempts need to be done via at least 2 modalities, which include by phone, mail, email, or text, depending on what we have on file for the beneficiary. We can move on to the next slide, Natalie. So what we've done in order to meet the requirements of the rule, General Assembly passed budget item number 292-6C last year. It became effective on July 1st, and it requires DMAS to contract a vendor to create a centralized mailroom for inbound mail handling for items sent to our members. And so this mailroom would again handle inbound mail as well as administratively returned mail. And right now that's being handled across the 120 local agencies throughout the Commonwealth. And so just kind of where we are now versus where we're going. We are looking to streamline this process for the handling of the inbound mail, which will assist with more timely processing of documents. It will help reduce any sort of delays and relieve the burden off of our local agency workers from having to handle this processing. And it's also going to allow for better and efficient reporting and tracking for the inbound mail. As of right now, with 120 different local agencies, we have many varying processes on how the mail is currently being handled. And so the reporting isn't complete right now. So we're looking to improve on that. Natalie, if you want to go to the next slide. All right, so what DMAS is doing in order to implement this mailroom. So we have named this the Cardinal Care Correspondence Center, and we're looking to go live with this operation this summer. And what we've done is we've partnered with with Maximus, our Cover Virginia vendor. Cover Virginia currently has a mailroom within scope of the contract. They have an inbound and outbound mailroom for the applications that they're working in-house, and they also are mailing to the Department of Corrections and regional jails for their CVIU, the incarcerated unit, Cover Virginia incarcerated unit area. And so we're just looking to expand on their current operations for this project. And we're going to be implementing this project within a phased-in approach, which we're going to go through in this presentation. The first phase that we're going to do is inbound mail handling. And so inbound mail is defined for this scope as new applications. So if somebody gets a paper application, they fill it out and they mail it in. Or if they get a renewal packet sent to them in the mail and they confirm everything, sign it, and send it back in, that would be sent to this new centralized mailroom. And then returned verification documents. What that means is if an eligibility worker is unable to determine the case, they need to verify more information, let's just say income documentation, or they need to obtain citizenship documentation. They send what's called a verification checklist or a VCL. And the individual then is instructed to mail in those documents. And so all 3 of these items will be updated to include mailing instructions to send to this centralized location. Again, that is the first phase of this process of this project. The second and third phase are bucketed as administratively returned mail handling. And the first phase 2 of that is returned mail generated out of the the eligibility system, which we refer to as the Virginia Case Management System. And then the third phase is going to be for administratively returned mail generated out of our enrollment system, which we refer to as the DMAS system. Once the mailroom receives any administratively returned mail, they will then scan it in and transfer it via our bulk upload process to upload into the eligibility system. You want to go to the next slide, Natalie? All right. So some of the system changes that we're working on to support the inbound mail handling. Again, the inbound mail handling are those new applications, renewals, and returned verification documents. We are working closely with our DDSS partners and to make the needed system changes into the VACMS system. We are slated to push be able to push those systems through, those updates through in May. However, we know that this is likely gonna not go live in May. So there will be a process to deploy to production when we're ready to go live with the project. Some of the items that are included here are an improved alert system. So it's going to separate alerts when items are scanned in by the mailroom that require worker processing. So it'll provide them with a separate alert process, as well as a new dashboard for workers as well as leadership to better track the documents that are pending further action from the worker. It's going to improve system functionality so that workers and our automated processes cannot take an adverse action on a case if there's documents pending worker action. So what does that mean? If a document is received, a verification document's received, or let's just say a renewal packet is received and it's scanned into the system, it's going to tag that to remove it from the auto batch closure process that would close a case. It would also alert the worker if they go to take an action on the case without first reviewing the document and applying it into the case. So it's going to ensure that there's no adverse action taken without first reviewing those documents. It's going to allow for system processing of address changes, which currently require worker manual processing. And of course, it's going to improve tracking and reporting for the scope of work. And if we want to move on to system changes for returned mail, the next slide. Some of the items that we're going to be improving in the system is the ability to track and report on the dual modality outbound attempts, which we touched on earlier. The requirements to make the outbound attempts via the telephone calls, emails, text messages. We'll have the ability to systematically track those attempts and the outcomes of those. We'll have the ability to check against other agency databases within our eligibility system to see if there's other addresses found in those systems. And we are working towards getting access to the National Change of Address database to be able to see if we can find any updated addresses in that system as well. And we can move on to the next slide, Natalie. All right, as I mentioned, we are modifying the Cover Virginia contract to support this work. One of the themes that you'll see here is a 2 business day processing window. So some of the requirements and that are going to be included in the modification are for timely processing. So for new applications and renewals, the mailroom will have 2 business days to get those scanned into the system and alert the worker that they've been scanned in. Now that is for all applications and renewals outside of pregnant women. For pregnant women, since we have that shortened time frame to process those applications and renewals, they're going to follow a 1 business day requirement. Return verification documents also will follow a 2 business day rule. An administratively returned mail will follow that 2 business day rule as well. With the administratively returned mail, of course, we have those other actions that we have to take. And so the contractor will be required to resend mail within 3 business days of being received. Again, that's if we have that yellow forwarding address sticker included on the returned mail. If we do not have a forwarding address, and the attempts to contact the member via 2 modalities have to be completed within 5 business days. All right. All right. And so that kind of gives you the overview of where we are with the centralized mailroom, or excuse me, the Cardinal Care Correspondence Center, the whys behind it, the plan ahead. We did want to just kind of highlight here the different escalation avenues that everyone has. We have an established group email for local agencies to use in order to contact Cover Virginia, and then I've included the Cover Virginia phone number here, as well as a link that's included on the DMAS website in case any inquiries or escalations are needed there. For this project, and Natalie, you can move on to the next slide. We are ensuring to collaborate with our partners. We are meeting biweekly with our partners with VDSS. We've contracted with Guidehouse as a consultant to provide consultant services throughout this project. The Guidehouse is currently working to conduct interviews with our VDSS partners, some of our DMAS personnel that has a hand in mailroom handling currently. As well as they're going to be submitting a survey to our local agency workers as well. With Guidehouse, we are meeting again on a biweekly basis, and we have included VDSS representation as well as local agency representation and representation from Virginia League of Social Services and BPRO as part of those meetings, so that we can discuss project updates, where we are, areas of opportunity, discuss the feedback from the interviews, and apply best practices. I know that we went through that very quickly. Again, I was trying to stay within the time frame here, but I can go ahead and open it up to any questions that anyone may have on this.
I do see in the Q&A, it says, for the project scope, why can't it be initiated by the client itself? Is there no app? Can Cardinal Care app not be an option to report any changes?
So they do have the ability, beneficiaries do have the ability to go in and make changes through the Common Help site. That is currently live, it's current functionality. They do have that ability. It's just ensuring that they do, because it doesn't always happen. And so the mailroom and the processes that are being put in place will identify when an address change occurs and take the appropriate action.
Are there any more questions for Danielle? Double checking. Don't see any there.
And I'll stay on in case anything is put in the chat and be able to answer it.
Okay. Well, our last speaker had some technical difficulties, and it looks like no matter how many things I've tried, they are unable to log in today. So I apologize for that today for anyone that was attending, in hopes of hearing a little bit more about the Virginia Rural Health Association. Hopefully, sometime in the future, we'll be able to have them back so that they can share their information. I'm definitely in the booklet that's shared. Will have their slides. So if you need to get in contact with the executive director, you are more than encouraged to do so. At this time, I do want to At this time, I do want to ask if anybody has any additional questions before we kind of move forward to wrapping up today's session due to our third speaker being unable to attend. Make sure I capture them. If you have any, please drop them in the chat. If not, if there is anything that either one of our speakers wanted to add, since you were on a time crunch and you didn't get a chance to do so, I want to ask either Sarah or Danielle if they have anything they wanted to add or re-emphasize before we wrap up for today.
Thank you, Natalie. I don't have anything extra, just certainly available. I put my email in the chat, so available for questions if anyone has them.
Anything for you, Danielle?
No, I don't think that I had anything to add. I got through everything. It was just said really quickly.
All right. And then we did get a request for your contact information, Danielle, or the contact information for anyone that wants to ask further questions about.
Sure, I can provide that.
Excellent. All right. Well, we thank you so much. If you want to stay connected with us, please do not hesitate to connect with us on the Cover Virginia website. Under the partner section, you'll see community stakeholder meetings. I'll make sure to add an additional slide for how to get to that moving forward in a QR code. If you also wanted to sign up or have someone on your team or other community members or stakeholders or providers, anybody that wants or could benefit from the information we are sharing through this particular stakeholder meeting, please have them sign up to receive notifications and additional information and follow-up information for any of our presenters. Or if you just want to stay up to date regarding any of the things happening through the Virginia Medicaid program, you are welcome to do that as well through these QR codes. Our next meeting will be on June 26th. Typically we have the third Thursday, and that will be Juneteenth. So hopefully everybody will be on holiday. I myself will be on holiday, so we're going to reconvene the following week on the 26th of June. So we thank you as always for joining us. If you have any questions or you have any additional topics that we should consider in future meetings, please don't hesitate to send them my way or drop them in the chat here. Any way that you think would benefit the total body, we are always happy to see and review those things and see if we can accommodate those requests. So as always, thank you for your time, for your patience. Thank you for showing up, and thank you for your questions. And I hope everyone has a lovely, lovely day. Have a good one.